Our region's business is sponsored by PNC for the achiever in you.
The debate over the future of healthcare in our region goes far beyond Obamacare and what's going to happen with healthcare.gov. It gets down to the basics of two big institutions with differences of opinion exactly as to how our region should move forward when it comes to healthcare. The region's largest health system, UPMC, has declined to extend Highmark's in-network contract beyond next year in response to Highmark's acquisition of the old West Penn Allegheny Health System to form the new Allegheny Health Network. Elizabeth Concordia is Executive Vice President of UPMC and President of the Hospital and Community Services Division. Greg Peaslee is Senior Vice President of UPMC as well as its Chief Human Resources and Administrative Services Officer. Welcome. Good to have you both here.
Thank you. It's nice to be here.
Thank you, Bill.
All right. Well, let's start with the basics. Obviously, this whole debate has been playing out on television and in a variety of media for months and months and months, it seems. The basic issue here is whether or not Highmark should have a contract at UPMC. Why should Highmark not have a contract at UPMC?
Well, as you know, as you've seen in the various media, Highmark has said that since they've acquired Allegheny Health Network, they need to move 41,000 admissions to their system to ensure that that system can be successful. That's more than 25% of the total admissions within UPMC in Allegheny County. So if we allowed them to take those admissions and move them over to their hospital, it would absolutely have an impact on UPMC. And we have spent decades providing high quality care to our patients, and we're focused on providing that care to our patients, and we want to continue to do that. That's why we can't have a contract.
So it'd be a big chunk out of UPMC. They could also take it out of the community hospitals potentially.
Absolutely.
Yeah.
They've said, however, that most of those admissions would come from UPMC.
Well, and is there that much give in the region in terms of capacity? I mean, do we have more beds than we need? That this becomes a zero-sum game in some way?
We do, Bill. I think all experts, Highmark would agree with us on this, that there are more beds in this region than we need, and there have been for many years. So what we're faced with is a non-growing population. Right? This is Western Pennsylvania. Maybe we've stabilized the population, but we're not growing. The use rates, the admissions are going down every year. So the number of patients that need inpatient services are going down in a region that is already overbedded. We have hospitals that have been fully capitalized, that are providing the great care that Liz mentioned. So from a community standpoint, we don't know why it makes a whole lot of sense to reinvest into hospitals when they're not needed in this community.
Well, the question, though, is does that mean there's a day of reckoning out here no matter how this shakes out? It sounds like if we're overbuilt at some point to manage this whole system, even as individual players, it's going to have to be rationalized.
Well, sure. At some point, as Greg said, there are a finite number of admissions in this region, and we don't need all of the hospitals that we have. And so, again, there lies the question, do you really need to increase and grow the number of patients that you have at West Penn? And we're saying that we've been focused on taking care of patients, and we think we provide, and we know we provide high quality of care. And so we want those patients to continue to come to UPMC, and we really are focused on making sure that we look after UPMC and the patients that we see.
Yeah, you know, I suspect if you both were for-profit companies, we wouldn't be having as much debate. It would be an interesting business story. But the fact that you're nonprofits introduces a really interesting aspect of this, and it's a point that Highmark's made, that UPMC, an incredible success story and transformative for our region's economy over the last 30 years. In large part because the government's put a lot of money into it, tax money, foundations have put a lot of money, private givers have put a lot of money into a charitable operation. And so don't people, and this is kind of Highmark's point, don't they deserve access because of that amount of contribution and investment over all these years?
Well, I think, Bill, people do deserve access, and people will have access. I think the reality is the majority of people in Western Pennsylvania have access to UPMC and network today. The majority of people in Western Pennsylvania will have access after 1/1/15 as well. Medicare patients, medical assistance, government programs all have access today, will all have access. Most of the commercial market, look at what happened with Westinghouse's announcement 3 weeks ago. They are going to provide insurance to their employees, to their 6,000 local and 14,000 national employees from Aetna, which will allow them full access to UPMC. The city of Pittsburgh is offering choice as well. all the major employers are going to make sure that their employees have access to UPMC and network. We estimate that 95 to 97% of the people after 1/1/15 will have a choice to make. They will have access to a network that will give them full access to UPMC, or they will have access to another one. And remember, narrow networks, are really the name of the game today. When you look at Obamacare, over half of the filed plans nationwide are narrow networks, do not include all of the providers in any region. This is not a phenomenon that is just local to Western Pennsylvania. This is the national change that is occurring.
And we've had the luxury here for many, many years of virtually go anywhere you want, and that's a wonderful thing to have. But what you're saying is the way medicine seems to be evolving, this idea of having to do a little picking and choosing and having these networks is just an inevitability?
Absolutely, and choice and competition are important. So you look at what's happened in our market now. Now we've got both local and national insurers here, and that will force competition, which will be good for the employers and employees to keep costs down. And we believe the best way to ensure that affordable choice and affordable access to care is for UPMC and Highmark to not have a contract. Very similar to what happens elsewhere in the country.
All right. Well, obviously, lots more to come. Looking forward to see how it all shakes out. Elizabeth Concordia, Gregory Peaslee with UPMC. Thank you both so much. Appreciate it.
Thank you so much, Bill.
And we'll be back in a minute with a little dollars and cents. Stay with us.